PM because AM is the, yeah, this one. What is 250? Wednesday?
Wednesday through, no, AM, sorry.
All right, so this practical, it's pictures, but it's 3D for the most part. These kinds of things, these models, posters. You'll have a palpation station. So we got 24 in the class. We'll probably have 25 stations. They will be scattered amongst the room. We'll probably even use a community room as well. We're gonna use both rooms?
It's up to you. You usually have your little,
Outpatient thing in there.
so it would just be hard for me to bounce back and forth, but with
That is
questions,
true.
that's the only
That is
thing.
true. I think we could do 25 in here,
I think you could, if we shifted some desks out this way.
and that's what we'll do. That's what we'll do. This one takes a long time for us to set up, so once you take this in the morning, next Monday, you are out of here. Out of here. There's no more studying, in other words. You gotta go on your own. All right, so don't plan on staying in here and studying for this thing, because we'll be setting up the room. You can study, but it's not gonna be with the models. 25 stations, 3 questions per. And we'll figure out the time, but I think it was like 2 minutes per.
2 minutes or so.
2 minutes per station. So it's pressure. It's, you pretty much either know it or you don't. Bony landmarks, origins, insertions, bony protuberances, nerves, all the stuff you see on the 222 picture quizzes. That's what you'll have. And you'll have a word bank, which will be very helpful.
Obviously, with only like 2 minutes per station, if you have a question, you can't get to everybody. So,
It's really black and white.
Yeah.
There's not a lot of room for interpretation.
if you need clarification on exactly what it's pointing at, I will give that to you. But that's basically all I can give
Yeah,
you.
we've done this. So we've got it down to where it's pretty good flow.
It's gotta be better kind of easier.
Any questions on 222?
I have a question on what you have right here. So you have 25 stations, and then, I don't know what the middle part of that is.
3 questions per station. So it's 75 questions. Yep. 2 minutes per, you get 2 minutes for 3 questions. What else do we need to know about that? Oh, the way we'll do it. All right, so what you'll do. No, it's, I mean, just procedural type of thing. Everybody meet in the break room, and we'll come over and we'll put you in like alphabetical order or whatever, and then you'll come in and who's the A? Are you number 1? If we go that route, you will start at station number 1.
So you start on question 1, but station 2 starts on question 4. So don't get confused with that, because
Please don't. do
last
that.
year,
Yeah, we had.
they didn't shift, and so someone completely got the whole thing
Yeah.
wrong.
Filled out the whole thing. We worked with them. We didn't count the whole thing off, but man, it was a mess.
Yeah.
It was a mess. Does that make sense to everybody?
And the stations will be clearly labeled.
And you will not get to go back. So your 2 minutes is your 2 minutes. There's no going back to the station or anything like that. Yeah.
Will you have a timer on the board that makes a noise when 2 minutes is
I
up?
think we could probably do that, can't we?
Did say we will have a word.
She's a traffic cop. I handle the palpation station. You'll have to come in her office and palpate 3 things. And either you get it right or you don't.
That's what I was gonna ask, was the palpation.
Palpation station? Palpation
I was just
station.
gonna say palpate this and you have to do it.
And it might be on me, it might be on you, it might, you know, whatever.
Is it gonna be like a bony landmark or a muscle?
Whatever.
Yes, yes.
Good try, though.
I tried.
Will it be of the spine or trunk, or no?
Anything.
Yes. Anything else about that you can think of that you didn't ask?
We'll have it spread out enough so you understand the flow, but the stations will be clearly labeled,
Yeah.
so you know where to go. Cause you'll probably jump from there to over here, so.
Yeah, we'll
But
move
I'll
these
let you
tables
know.
around and, you know, again, we use the posters and all that kind of stuff, so. Be a bunch of stuff going on. Yeah, that's that. 250. Which is Tuesday, right? All day. So everything's up on the board on what time you have to be here. Again, you report into the break room, and all you need is a piece of paper and something to write with. And your brain.
So we can like write down
Absolutely.
what we wanna do?
Absolutely, and well, you should. Yeah, you'll get, we'll hand you the scenario, and you'll come in here and you'll have 5 minutes to read it and get your plan of attack, okay? You'll also, during that 5 minutes, you will have a patient scenario, when you're the patient. And we try to help you with that too, because we know you're much more worried about doing this other thing. But reading and doing the right thing as a patient is critical for this thing. If you bomb that, you will have points taken off, okay? If you bomb being a patient, if you totally just miss what the whole patient scenario is, there'll be points off for that. But again, we will prompt you, we will encourage this behavior or, you know, this affliction. You know, so basically you just need to read it real quick. Take you 30 seconds to read it and be done with it.
You're able to hold the patient, when you're the patient, you can read it as you are being the patient, as long as the therapist
Yeah.
doesn't see.
Something like, you have 7 out of 10 pain in the right upper extremity. You may not remember that, but you can look at the paper and say, and if you totally whiff it, we can chime in on that too, so that's not a huge deal. But again, it's imperative, because we don't have real patients. It's imperative that you guys act like real patients if you can. Okay. This one's pretty straightforward. We don't try to trick you too much. But this one will just say, you are required to do this vital sign, this range of motion, this, sometimes we put palpation on there, special tests, manual muscle tests, whatever. Okay?
Essentially, yeah, but you gotta figure out what to do based on your scenario.
What's the question?
I was saying, so y'all do tell us like what to do, pretty much. It's just a matter of knowing.
Well,
everything.
without giving you too much of it, it might be something like, perform a special test
To do that, yeah.
appropriate with what you see clinically. Does that make sense? So if you had symptoms of carpal tunnel syndrome or something like that, we know there's certain tests that you should do with that. You might not have to do all of them. We probably wouldn't want you to do them all. We're not gonna have time for that. But you'll have, I can't remember exactly the time. 20 each? Yeah. So you have 20 minutes to fulfill those, like, I think it's 4 requirements. And then you'll have another 10 minutes to do a 10 minutes or 15 minutes? It said
It
that.
says 15.
15. That way you get a whole hour. That's right. 5, 20, 20, 15. So you're here for an hour.
So the piece of paper that you bring, that's for your soap notes. So
Yep.
don't scratch it all up with all your notes. Use the paper that we give you to write down all your notes.
Yeah, you can do that too. Because you'll have a piece of paper. And then when you're done, what do? Leave. Do you talk to anybody? You sit in the parking lot and wave everybody down, say, "Oh, that was awful. Dr. Levin's, oh, he's horrible." Well, no, you don't talk to anyone. You leave and get out of here. Okay. Whoa. Put that right there.
Will you guys be asking us questions like you do the skills check off, or is it so we don't have to?
The only time I'm gonna ask questions if I can't determine what you're doing, like palpation, or if you're doing something and I'm not sure what you're doing, I might ask, but she doesn't say anything, she's cold. I will ask if I don't know.
Like, don't figure out what we're doing through our soap notes, like all of our, like the.
No, I'll figure it out by watching you,
Okay.
but then you're gonna write what you do. And if you look on that rubrics, and I think I posted that too, right? So you've got what everything's worth and all that stuff.
So we're allowed to take notes as we're doing the exercise?
Absolutely. Absolutely. But at the same time, you're in patient engagement.
Right.
You can't have your hand down here, "Hey, Miss Patient, I'm gonna do," you gotta do what you gotta do, then you go over and make a note, that's fine. But don't sit there with your head in the book over here. That's no good. That will not fly over well. Yep.
Are we both getting our scenarios at the exact same time
You'll get your scenarios at the same time. You both have 5 minutes.
at the beginning?
Yeah.
to read?
And then,
And whoever, just gotta remember it.
like, you gotta go remember to wash your hands. During the time you go wash your hands, I'm over here saying to the patient, "Hey, this is what's going on. Do you have any questions about this?" That kind of thing, so. Is there an advantage going first, or I don't know.
And that doesn't matter, it's just up to us and our partner to decide who goes
No.
first. Or
It's
just in order.
whoever's up there first is who's the PTA first.
Pay attention to the rubric with all the asterisks. Those are the ones that are all critical.
And we'll
safety.
practice, we'll do a couple case scenarios later this week, okay? So we'll really point out, especially the critical safety elements. Can you read them out, critical safety elements?
First one, student washes hands before and after treating the patient, provides clean linens for treatment area, and disposes of any dirty linen appropriately.
So if you don't do those things, you automatically fail. Now, are you gonna allow for hand sanitizer
Yes.
instead of washing hands?
Yes.
You will have to wash your hands before with me, but you can use sanitizer or something afterwards, fine.
Student positions patient in preferred or acceptable alternative position. Patient appropriately supported and draped as needed. Joint to be measured is exposed.
You can't have someone's butt hanging out. You can't, put them on a rolling stool. We've talked about that, haven't we? Patient can never be on a rolling stool. If they fall off that, you're in trouble. So that can't be done. Common sense with positioning. Lots of scenarios to think about there.
That was for GONI. For manual muscle testing, student positions patient in preferred or acceptable alternative position. Patient supported appropriately.
Don't put somebody on the edge of the table, then walk away. Okay?
Special tests, student positions patient and performs tests correctly. That is a critical safety element. Other tests, student positions and patient and performs tests correctly. Safety, student ensures patient safety by assistance and attention to obstacles in the environment. Student displays proper body mechanics throughout treatment. And that's it. So you get docked for any of those are automatic fails. You automatically have to remediate. Your score may not reflect that, meaning you may actually get an 85, but you still have to remediate because you failed a critical safety element.
Everybody's blood pressure's up now.
As far as the clean linens,
I will have everything that you will possibly need and more in my place over there.
I will have that out here too. You won't have to retrieve godiometers and all that kind of stuff. Yeah, we really set you up easy on the first one. But we will practice this. So tomorrow we got checkoffs, right? Yeah, checkoffs tomorrow. So Wednesday and Thursday, if we get done with checkoffs and everything, we can practice. We can practice. And we will. Yeah. Yeah, we should be good there.
So it's 20 minutes to do the examination.
20 minutes to do what you need to do. Yep.
15 minutes to write this
15 minutes, right? So,
Well, we write our sub notes at the same time, right?
yep. So it's 5 minutes prep. You'll come in here, you'll sit down, you get to read over the scenario for 5 minutes. And it's not but a paragraph. It's not like pages and pages of charts. One person goes, takes 20 minutes, the next person goes, takes 20 minutes, that's 45 minutes in. And you have 15 minutes to write your sub note, and you just put it in our box. And then you walk out and you leave. Okay? All right. Cameron, are you willing to be a participant today? I won't hurt you, I promise. And might hurt you.
Bring it on.